Our main goal in developing the geriatric fracture program at Rhode Island Hospital was to really give the best possible care to this growing population of elderly patients that sustain fractures from trivial falls. So for you or for many of us, if we fall from a standing height, nothing happens. But for these elderly whose bones are more porotic and then they have associated medical conditions, this fall can be devastating. Our geriatric fracture program has been in existence since the fall of 2011, and we've already noticed changes. What we've done is we've brought together orthopedic surgery with our geriatric internal medicine colleagues, and that forms the core group. With them, we've coordinated nursing, discharge planning, the emergency room and their physicians, anesthesia, the other subspecialties of medicine such as cardiology, in order for all of us to work together to provide the care that's required.
The new program was developed to help address an increasing need in the collaboration and co-management of geriatric hip fractures. Most people don't know that the geriatric hip fractures are very common in the older population. Their number is approximately 330,000 hip fractures each year, and the number is expected to rise to around 550,000 by the year 2040. Having a system in place and having all these key players, having a lot of education in terms of all the healthcare providers who help take care of these patients has really increased the patient and the family satisfaction. We are all working together to help not only treat the patient but also help answer all the patient's queries and questions, help them to make them well aware how long the process will take place, how long the surgery would be, and how long before the patient can actually be discharged from the hospital and either go to skilled nursing rehab or acute rehab or sometimes to home.
In our state, here in Rhode Island, the elderly population is growing. We see an ever-increasing need, and we think that by providing this coordinated care that we can address the needs of the patient and their families. It's always nice to have grandparents around that can participate with their families, and we think that this is a key component in maintaining their vitality.